Good evening, Senator Millett, and the impressively enduring distinguished members of the committee. My name is Dustin Sulak. I'm an osteopathic physician licensed as a general practitioner here in Maine. And my professional areas of focus are integrative medicine, which is the combination of complementary alternative medicine and conventional medicine, and also medical cannabis. And I'm widely respected as an international expert in this field. I speak locally at the Maine Osteopathic Association Conference, Maine Academy of Family Practice. And because of my areas of focus, my practice attracts people that have been refractory to conventional care. They've failed to respond to conventional treatments. They seek me out for experimental treatments. And because of that, I spend a lot of time going to the primary literature to understand the risks and benefits of experimental treatments in my patients. I'm here to oppose LD798 today, and I'm not going to read through my testimony. I'm just going to give a few highlights and answer some of the questions that I've heard. I think even at this late hour, I have some nice surprises for you all. So first of all, I just want to highlight some issues of medical ethics from the AMA Code of Ethics. Point number 3, a physician shall respect the law and also recognize a responsibility to seek changes in those requirements which are contrary to the best interests of the patient. And number 8, a physician shall, while caring for a patient, regard responsibility to the patient as paramount. And I think you've heard a lot about informed consent and medical ethics today, and I'll leave it at that. Using legal force to circumvent informed consent violates medical ethics. So a few things that I want to address, because it is a little confusing to hear such controversy amongst my field. You know, I'm surprised that the Maine Osteopathic Association and the Maine Medical Association so strongly oppose LD987, which would give physicians more authority and more power to look out for the best interests of their patients, and to support a bill which would remove that. I want to begin by showing this document, which is the rules, Chapter 126 and 261, that pertain to immunization requirements for school children. And just to clarify the strict criteria on medical exemptions. So what I'm describing now refers to measles, mumps, and rubella. There's 4 criteria for medical exemption. 1 is pregnancy. 2 is known altered immunodeficiency, such as tumor, congenital, and long-term immunosuppressive therapy. Number 3 is anaphylactic reactions to eggs or neomycin. And number 4 is anaphylactic reaction to measles, mumps, or that vaccine. So basically, you're either pregnant or you've had a life-threatening illness. That's the only way to be exempt from some of these required vaccinations. Now, I think part of the surprise that I have for you is the answer to the question of, do unvaccinated children pose a higher threat to the public than the vaccinated? The written testimony that I submitted is highly referenced with peer-reviewed literature. I want to just begin by describing some of these required vaccines. Tetanus, for example, is not a communicable disease. You can't catch it from anyone. You catch it from a puncture wound that's infected with spores. The IPV vaccine, the inactivated polio vaccine, cannot prevent transmission of the polio virus. The citation is from the New England Journal of Medicine in 2007. Of course, the oral polio vaccine, which has been phased out, did prevent transmission, but the current polio vaccine only prevents the expression of the symptoms. It can still be carried and transmitted. While intended to prevent the disease-causing effects of the diphtheria toxin, the diphtheria toxoid vaccine is not designed to prevent colonization and transmission, again, only to prevent the onset of the disease and the symptoms. So these children that have lacked or gained vaccination one way or another have no difference in their rate of threat to the rest of the population who has received the vaccine, or maybe who hasn't. Other examples include hepatitis B, which is a blood-borne infection, and most of our children at school are not being exposed to bodily fluids, and I don't think that this is really applicable. So the broad language of this rule really includes a lot. It's just too broad, and it includes vaccines that don't need to be mandated. And so I'll just summarize here. LD798 and any legislation that would use legal force to essentially mandate a medical treatment violates medical ethics. The safety and risks of vaccination are not fully understood. There's a high rate of emergency room visits after childhood vaccinations. Vaccination is not always effective,
Yeah,
and
you
many
really
of the
need to wrap up.
last point, many of the vaccinations that would be mandated by this bill have no impact on the safety of the general public and should remain a personal choice.
Great. Thank you. Are there any questions? Thank you very much.